drug therapy in endocarditis, therapy of native wall endocarditis caused by highly susceptible viridians group Streptococci, gram-positive bacteria, Streptococcus bovis, salivarius, mutans, mitus, and sangius. The 2-week therapy. 2-week therapy or 2-week regimen not intended for patient with cardiac or extracardiac abscess or those with creatinine clearance less than 20 ml per minute and the patient with age more than 65-year old. 2-week therapy not recommended. In this patient, we need to use 4-week therapy. The most commonly used drug is aqueous crystalline penicillin G. The adult dose is 12 to 18 million units per 24 hours intravenous continuously or 4 to 6 equally divided doses. The pediatric dose of penicillin G is 2 million unit per kg per 24 hours intravenous in 4 or 6 equally divided doses. And if the patient has mild or non-IgE mediated reactions to penicillin, the mild or non-IgE mediated reactions include delayed rash, gastrointestinal upset. Then ceftriaxone sodium is another option. The adult dose of ceftriaxone is 2 gram per 24 hours in one dose, intravenous or intramuscular. The pediatric dose of ceftriaxone is 100 milligram per kg per 24 hours, intramuscular or intravenous in one dose, and duration of therapy is 2 weeks. In 2-week therapy, in ceftriaxone, we need to add gentamicin sulfate. Gentamicin is an aminoglycoside antibiotic. The adult dose of gentamicin is 3 milligram per kg per 24 hours, intravenous or intramuscular in one dose. The pediatric dose of gentamicin is 3 milligram per kg per 24 hours, intravenous, intramuscular in one dose or 3 equally divided doses. As the gentamicin is aminoglycoside antibiotic, the adverse effect include ototoxicity or nephrotoxicity. That's why the gentamicin it's an contraindicated in the age of 65 or older patients due to ototoxicity or nephrotoxicity. And that's why this 2-week regimen we are not recommending in the patient whose age is above 65 year and the patient who has impairment in the 8th cranial nerve and renal function. The mechanism of penicillin inhibit the cell wall synthesis. Ceftriaxone, cephalosporin also inhibit the cell wall synthesis, and gentamicin sulfate is an aminoglycoside antibiotic inhibits the protein synthesis by inhibiting the 30S subunits of ribosomes. So for the 2-week therapy, we can use alone penicillin G, or if the patient has mild non-IgE mediated reactions, then we need to use ceftriaxone plus gentamicin. Thank you very much.